George. Good. Actually, I went through the calculations for you. You know, this patient, you see the weight up here is 78 kilograms, and we use the patient's actual body weight when we're using the heparin protocol. So I calculated the bolus, the 30 units per kilogram, and I came up with 2,340 units, which is 0.5 or rounded to 0.5 cc's of heparin. So that is correct, as documented on the MAR. When I calculated the increase in the infusion rate, I calculated the new infusion rate to be 14 milliliters per hour.
Okay, good. That's exactly what I have on the smart pump, so that's good. So if I'm looking correctly at the protocol, I'm using the heparin injection for my boluses, and then I'm using, obviously, the bag for the infusion. So is that why I have multiple heparin orders on the EHR?
Yes, I know that could be a little confusing, but it is put there to decrease any chance for medication errors. So your initial bolus of heparin and your reboluses of heparin, according to the protocol, you will always use the injection. So that's a small vial. It's a 5,000 units per 1 cc.
Right.
And then you do use that for the boluses, and then you increase the infusion rate out of your bag.
Okay.
And that's just, mainly because heparin's a high-risk drug, and so we don't want nurses or any healthcare professional bolusing out of the actual bag, because that would increase the risk of a med error.
Right.
So hopefully that makes sense, and I think the more you do it, the less confusing it'll be, the more patients you have on heparin, or and that you see the protocol.
Yeah, no, I'm glad that they're separate. I think that keeps them easier to understand. So I just have one more question, and that is, so since I gave the patient the bolus, and now we know that the rate is correct, does that mean that I still have to stick the patient again every 6 hours?
Unfortunately, you do, because we've made a change in the rate. Also, we have to have 2 heparin levels within the reference range, or the goal range, which is 0.3 to 0.6 for our cardiology protocol. So once we have 2 levels within that range, we can change checking the next heparin level to every 24 hours. But up until that time, it is every 6 hours. So it looks like from the time that you made these changes, or the prior nurse made the changes, we're looking at about 12:45 today.
Okay, very good. I'll draw it then. Thanks so much for your help.
Sure, anytime.